Greetings, madam. My name is Navasakti. The disease I chose for the assignment given is Pemphigus. It is a disease that affects the skin. First of all, I would like to explain the anatomical structure of the skin, which is normal skin. The skin is the largest organ in our body. The skin is composed of three layers, which are epidermis, dermis, and subcutaneous tissue. As you can see from the diagram above, the epidermis is the outermost layer of the skin. The dermis is beneath the epidermis, and the subcutaneous tissue, also known as hypodermis, is the layer beneath the dermis made of fat and connective tissue. The skin has many functions. It protects us from mechanical, thermal, and physical injuries, harmful agents, and many more. Skin is also the organ that triggers a response if we touch or feel something, including the sensation of pain. Other than that, it helps regulate our temperature, produces vitamin D, and much more. Now let's get into the disease, pemphigus. Pemphigus is an autoimmune disease that causes blisters and sores on the skin or mucous membranes, including the mouth or the genitals. Pemphigus can develop at any age. However, it is most prevalent among individuals in their middle age. It is a long term, also known as chronic condition, and some types can be fatal without treatment. Medication is usually effective at controlling it. The most common type of pemphigus is Pemphigus vulgaris, which causes painful sores and blisters on your skin and in your mouth. The main symptom of this disease is blistering on the skin, but in some cases, the mucosal surfaces, such as inside of the mouth, nose, throat, eyes, and genitals blister too. The blisters are fragile and tend to burst, causing crusty sores. This disease is diagnosed by performing a skin biopsy with direct and indirect immunofluorescence and enzyme-linked immunoabsorbent assay, also known as ELISA. According to a research done in 1992 for bulbous disease in Malaysia, Pemphigus vulgaris was the most common bulbous disease. This incidence of bulbous pemphigus was highest in the Indians of Malaysian origin, and they are most likely to develop Pemphigus vulgaris more than any other ethnic group according to the 2020 research. Pemphigus vulgaris had been reported to occur worldwide. Pemphigus vulgaris incidence varies from 0.5 to 3.2 cases per 100,000 population. Pemphigus vulgaris incidence is increased in patients of Ashkenazi Jewish descent and those with Mediterranean origin. Lastly, for the treatment and prevention, there's no cure has been found, but treatment like steroid tablets, other medicines such as azithromycin, methotrexate, and rituximab can help. It usually takes a few weeks for the blisters to heal, but once this happens, you will probably need treatment for several years to stop the blisters from coming back. It may be possible to stop the treatment eventually. If the blisters come back, you may need to repeat the treatment once again with the medicine. Systemic corticosteroids remain the gold standard treatment for pemphigus vulgaris. Azithromycin and mycophenolate mofetil are the first line of steroid-sparing treatment. There is no prevention from the disease, according to the research. That's all from me, madam. Thank you.